quorum. And this is actually a special meeting, public meeting, just to finalize the grants that we have asked for to complete our mission. And I want to point out a couple things. One, that all the grants have to address our core
Key
performance indicators as dictated by the state. The other thing is that in this money, they put an absolute cap of 10% on capital expenditures, which means that basically we can't go out and fund. We're really limited on funding anything that involves a capital expenditure. So I sent all of you kind of late, you probably didn't get it, but an email of the state list of our core duties. And, you know, they're basically, on public health, it's more on identifying, reporting, and then trying to alter conditions that lead to bad outcomes. It's not necessarily to treat. We have a duty to refer to treat for many areas, but we're not primarily there to treat these problems. It's to find out the scope, the nature of them, the impact on our community, and things that our community and that we could do to lessen the impact of these disorders. So we've all reviewed the grant applications individually. The staff has reviewed the grant applications, and we have actually we have a summary which I think will follow on our feelings on these. And the other thing is it will be somewhat, have to be some modifications also based on just availability of funds and how that breaks down. So any questions at this point? Okay. So I think the first two that we'll review our neighborhood health center and Birth to 5. And if you look at the summary, I think we felt that they were excellent job identifying the barriers to safe sleep in maternal and child health. We thought their being able to do home visits was a plus.
So we're focusing on Birth to 5 first?
Yes.
Okay.
And at least preliminary at this point, we feel that it's an area that we should fund.
Yes. And this was one that we were considering use of safety pin funds for?
Leaving Birth to 5?
Yeah.
Yes.
That's correct.
So I'm going to ask Mark to step out.
Does he work or is he on the board?
Other discussions on Birth to 5?
I guess the question is, are we going to go with the recommended funding that they asked for, or what's your thoughts on that, or our thoughts on that?
I think I'll defer to staff, but I think we're going to have to, after we've looked at the list that we have approved, then we're probably going to have to adjust
Come back
funding.
to the money. Okay.
Mm-hmm.
Is my feeling.
So we're going to decide who we approve today, and
Then we're going to have, once we've got those that are approved, then we're going to have to go through and see how that fits on how much we can actually give.
Because some of those, Dan, right, we talked the other day, would be separate from the
Yes.
new grant money, right? Because
Right.
the safety net
Right.
money was money you already have, right?
Yes.
You do have already?
Correct. Safety pin and COAG monies could be used to fund a couple of these different
Okay,
Yes.
that's what I was told, okay.
School aids and.
the COAGs.
Mhm.
Other questions? I'd entertain a motion to approve their grant with the stipulation that the exact amount funded is going to have to be determined later as we,
Yes.
as the staff then looks at the entire list that we approve.
Okay,
I make a motion to approve.
I second that.
All in favor?
Aye.
Aye. Opposed? Okay. And then the reason I'm skipping to Neighborhood Health Center is also because Mark is an employee. So I think we really like the idea of care coordinators. And we felt that would be a good outreach for us and something that we could contract out or grant out that would improve our scope. And we were interested in really more details on how they set a goal of improving blood pressure control by 20%. And we were kind of interested in how they questioned them and how they, did we have a chance to hear back from them? Or do you know that's?
Becca reached out to him, and I've not spoken to Becca, she's been off, so
Okay.
She's not sent me any emails or anything with their responses.
Okay, again, I thought, in general, we thought this was something that would improve our scope, and we were in favor of funding. But again, it would be, the exact amount would still come down to a final analysis. So is there a motion to approve, or are there more questions?
The Health First Indiana Fund, that's the other fund that you already have money for too, right? Or is that part
That's
of
the governor's funding that we have $357,000, I believe, left for this year for contractual services, and
Okay.
a little over $800,000 next year for contractual services.
So I guess my only question is, do we need to stipulate any part of this in the motion about which fund it's gonna come out of, or are we gonna leave all that up in the air?
I think it would be worthwhile to say that we look at all options for funding and pick the most appropriate.
Well, given what you said, then I can move to go ahead and do that, looking at all funding options to go ahead and fund the Neighborhood Health Center proposal.
Is there a second?
Second.
All in favor?
Aye.
Aye.
Aye. Opposed? Okay. Yeah, you want to ask Mark to come in?
Do we have to spend more time out?
Probably, no. I think those were the only two. Those we don't.
Okay, the next one will be Boys and Girls Club.
Now you can jump in. We're at the Boys and Girls Club, yeah.
I think we felt that this was kind of an extension of things that they were already doing, but they certainly were things that were directed at in improving fitness and school health. And again, isn't this one we felt that we could fund
Yes.
from the
This-
school?
Mhm.
last discussion was we could fund this with the COAG, better known as school liaison money. We could fund whatever the board decided to give, and we could fund that with that particular grant.
And I think there was enough money to fund that.
Absolutely.
And this is one where I think it really kind of works in more with our school liaison, improving that area. So if we move to approve that one, I would suggest that we stipulate that it come from the COAG money.
You also want to stipulate that the Birth to 5 money comes from safety pin.
That,
I think we left that as an option
mm-hmm.
to pick which was the most appropriate.
Says that student health KPI in partnership with schools and based on community need, the county organization must develop and implement wellness policies, comprehensive strategies to improve, to promote whole child health, including physical and mental health and well-being. Do you think it fits within that quite well? What was the total amount that they were?
59, just under 60. We'll talk to Honest.
Yes.
I move for approval with funding that out of the school liaison funds.
A second?
I'll second.
All in favor?
Aye.
Opposed? Next one to discuss is Bridges for Life. I think one of the things we had concerned is that it was really going to involve kind of an, by proxy, capital funding,
Yeah.
which we were uncomfortable with, particularly since the state has put some pretty big limits on what we can spend on capital.
They, of their 350,000, 228,000 was for a house, for housing.
And I think we felt uncomfortable with that and felt that that was not the aim of the state funding. But there was some discussion about, because they are a drug rehab program, of finding a way to support staff or some of that aspect of the program.
One of the problems that we also discussed was that their method of, we want evidence-based decisions made, and they're basically trying to treat drug addiction by teaching carpentry skills to drug addicts. And although I think that's a good thing, there's no real evidence that this is a valid method of getting someone off addictions to drugs.
Other comments?
If it did pair for some salaries, how much would that be?
looks like salaries with personnel is $116,440.
However, I'm not sure, maybe it's further in here, but what are the staff that they intend to hire, what will they be doing to address the core services? Because it talks about expansion.
Well, are you wanting to know the positions and how much they're getting?
Well, kind of, yes, but also like what the
What they'll do.
positions would be doing that would meet the core services.
I mean, I
Says
assume
these
some of the
workers-
positions are PT carpentry.
Says they'll be identifying, connecting with individuals in need of services, providing harm reduction support as needed, linking clients to community resources for mental and physical health needs, supporting clients in finding shelter/housing, assisting with gaining access to treatment as needed, and providing other case management needs. It says additionally, after the Health First Home has been completed, if they get the Health First Home completed, these workers will work directly with residents offering on-site support, continued case management, and recovery coaching as needed.
Now, would they even be able to, if they don't have the houses, will they be able to do the personnel part? I mean, is it something we really can't split apart?
Yeah, valid point for sure.
And I don't know if we have a good understanding of the population size that they're serving. Or the folks that they would plan to, the amount of folks they would plan to engage with if they were given this
I
fund.
think they did mention in the $228,000 billing, I don't have the paper in front of me right now, that they had 6 living spaces there.
Okay.
But I would assume that they work with more than,
6 units.
is it what?
It's 6 units.
6 units.
But would 6
We don't know
folks
how much
need
6 units
1,
provides.
2, 3, 4 different workers?
Right. It's not addressed as far as how many, the capacity of each unit. That's not
Yeah,
addressed.
yeah, sure, okay.
I'm getting the impression that we feel that this is not quite ready.
Mm-mm.
And we have several questions that would prohibit us from funding them at this time.
Amanda, the answer, I think the question that you were proposing is actually found on page 8 of that.
Page 8,
Of
okay.
that proposal.
Moving forward.
The measurable metrics.
Okay, thank you, sorry about that. $500 plus. In comparison to the amount of clients I currently have in services, and that it is a large number.
You have a large number, is that what you're saying in comparison?
My number in services currently is right around there for Wayne County,
Okay.
for adults. And we have a staff of like 25, so.
Well, it would seem though we would need clarification on whether or not the program works with or without the housing. 'Cause if it doesn't work without the housing, so is the amount that they've asked for more than, cause I don't do that, 20%?
You know, this is such a new organization. I think they're only like 1 or 2 years So the other question you'd like to ask is how effective have they been in reducing drug addiction? What are their numbers? I didn't see any of that going through here. I would like to know how many people came in that had drug addiction and after treatment or ongoing treatment, how many are no longer taking drugs? Those are the numbers I would like to see.
Because they're projecting, well, I guess it would be, projecting that they would have 40 people through the program by the end of next year.
Well, they don't, I don't know what the program is. And I guess the devil's in the details, but I just would like to, I just, for me personally, I just need more information about all of this.
And does this fall within our scope of our core duties,
Well,
which is
our KPIs?
Yeah,
our
so.
KPIs, which are basically to refer, but this one is,
It would fall under the core services of public health, but not necessarily under the key performance indicators. So,
Yeah. Yeah, it's not one of our KPIs, but obviously it's a good thing.
right.
Um,
Was there a reason we could not put this on hold to get more questions?
Don't we have to decide today?
yeah, I mean, it's the board's decision, but the previous timeline was to make the decision today. Notification of award is between the 24th and the 28th, and then the issuance of the money would go out June 1st. So, unless you think you can meet within the next 3
Well, I think
days.
the fact that it doesn't meet our core indicators is probably enough reason to say no.
It's not one of our KPIs, it was part of help first in the end, and that's what we got, we're getting the money.
Is there a motion? One way or the other?
You want to table it and come back to it?
No, it's good. I
Get
don't know if
it figured
tabling's
out.
gonna help us.
It's hard to say no.
Yeah.
I think, especially to people that are trying to do good. You know, and this is a good thing, so luckily I have no vote on your board, so I could just sit here and
Watch it suffer.
watch you twist in the wind.
I guess my thought is considering funding one recovery coach or something, or considering doing that to fund that to go in with all existing programming they got going, if we have funds available. And I mean, I'm a little biased when it comes to recovery because I was involved in the beginning of Hope House, so I know what kind of work gets done, and heard the same arguments from many people that it's not evidence-based, it's peer recovery model, and they've served literally thousands of folks in this community, and many have moved on. I'm no longer on the board, but anyway, so I think this is a similar model to, you know, to that, and so I struggle with the idea of if funds are available, why couldn't we consider funding one of their recovery coaches to?
You wanna make that a motion?
I'm comfortable making that motion. I
Okay.
just don't know where everybody else is on the board.
Is there a second? Anybody willing to second that motion?
I'll second the motion to pay for a recovery coach.
One. Okay. All in favor?
Aye?
Aye. Opposed? Okay.
Yeah, you could have given them more recovery coaches. They asked for 3.
So they asked for 3 recovery coaches and 1 full-time community health worker.
I'm just, my concern there is if they're asking it to expand the program, which include the house,
We can't do
then
it.
they have no, I mean,
Mhm.
what's that person gonna,
Right.
some of what that person's gonna do within the scope of how many beds they have to work on, so.
And this organization is receiving a lot of community funding from various
Is it?
areas, yes,
Okay.
yes. Yes.
You know, this also gives them an opportunity to show us
Yes.
what they did, and when
Yes.
they come back,
Yes.
you know, if we see those numbers and they're good numbers, you're gonna be much more likely to get
Mhm.
more from them.
Mhm.
Absolutely.
So the board approved to fund 1 recovery coach.
Correct. Go ahead. Again, it was a small amount. It was basically to set up a website. Um, But the consensus of people who reviewed it did not meet the KPIs.
It's a good thing. I mean, it's a great idea and a good thing, but it doesn't move any of our needles. It's not one of our KPIs. It's not a preventative, it's, you know, a reactive model for natural disasters.
Well, I think if we had unlimited funding, we'd fund all of it. If we had unlimited funding, and we felt they were going to benefit the community in some way. But
Mhm.
we have don't have unlimited funding, and we have,
This is what, a website, right, that we're gonna do or something?
Yeah, so
Yes.
they were gonna do a website and then essentially advertise on that website for membership and public information, things of that nature.
they have a long list of information. I think it was another way to try to get their name out to the public, that they respond after a disaster.
Correct, they respond. They're essentially the first phone call emergency management would make if emergency management needed extra resources.
And I think the website was kind of more to create public awareness and maybe as a recruiting device.
Correct.
Was removed to wish them well, but not fun.
So moved.
Is there a second?
I'll second.
Okay. All in favor?
Aye.
Aye. Opposed? Oak Park? I think there were some concerns that the PROS curriculum didn't really align well with our core services or KPIs. Unsure about evidence-based planning, and there was also concerns about how widely it would be available to the entire community. Other comments? Is there a motion to approve or not approve?
I'll make a motion not approve at this time.
I would second that motion.
Okay. Further comments or questions? All in favor? Aye. Motion carries. Purdue Extension. There were two components, I think, basically to that. One was, had to do with vaping and tobacco cessation, which we thought certainly was a very key component to our KPIs. And then the other had to do with just addressing fitness by safe walkways to school, encourage parents to allow their children to walk to school. And I think there was some concern expressed of just how successful that would be, although it was a laudable goal.
Dr. Wright held forth that he didn't think, the parents today are so helicopter parents that they probably, if they did walk, the parents would walk along with them.
Which is not the worst thing.
Which would be good for the whole family.
Everybody walks to school.
Everybody walks to school.
Kumbaya, right?
Right, we all ride our bikes and walk to school.
Although there wasn't any objection to them trying to develop that. It's an idea that's been kicked around. I've seen it come and go over the years.
I have to admit, I'd be curious to see if they could stir up any interest. And, of course, when we were kids, I mean, you didn't walk to school, you pretty much didn't go.
Yeah.
Or you bicycled or roller skated or.
And I think there have been other places who have done this, and I think there is some evidence that it has improved fitness. So I think there is some evidence that if you can accomplish it, it increases fitness.
So, however, I think they're gonna need, my concern partially is sustainability. Because it says here, ideally this position would be funded for a 5-year period to ensure that all schools were reached and that were provided significant time and resources.
How are they gonna spend that money? Amanda, is that, you got it in front of you on,
30,000 for personnel, fringe, 9,500, equipment 1,000, supplies 2,000, mileage, PSAs 10,000, bicycle safety supplies 2,000. So about $56,000.
Yeah, but we're obviously not funding 5 years. So
Yeah.
it looks like what they're telling us is that ahead of time, that they need time to show effectiveness. I think that's what they're saying.
It says, should we not receive full funding or be funded in subsequent years, Purdue has received an extension from the I-HOPE grant, which opens opportunities to braid funding sources together to cover activities.
Because I was thinking they had something where they were gonna fund it.
Was this one that also came under the school
Yeah.
program?
Yes.
So I think if we approve this, it might be one that we stipulate COAG money.
we've got over 400,000 co-ed.
Ooh.
It's hard to spend.
Yeah.
It's hard to spend.
I think as they stated, probably only
Yeah.
75,000 out of the co-ed grant.
My concern, these salaries are kind of low as well.
What, Amanda?
The salaries are kind of low, like $30,000. So is that more of like a part-time
It
position?
has to be.
Has to be.
It has to be, because otherwise,
We're not doing it.
you couldn't even afford to buy your bicycle.
No.
Yeah.
Not necessarily.
I know some of their employees out there also run multiple programs.
Yeah.
For each of their.
Okay, so maybe they wouldn't be hiring, but would be,
Adding to duties to people.
yeah, other duties as assigned.
Well, we'll certainly have a chance to review it, to see how effective they were. entertain a motion to approve using COAG money.
So moved.
A second.
Further questions? All in favor?
Aye.
Opposed? Okay. Passed. And the last one is Reed.
Yeah. Did we get additional information?
We do not have additional information.
Well, overall, I think we felt that this was another program that would, would extend our reach and
Mhm.
provide some employees. But I think our concern was is that we'd also like to see some people who are looking more at navigating than just educating or coordinating. Although you look at a coordinator, and in some sense, you could almost say, in some ways, a coordinator could, in some ways, be a navigator, depending on how you use them. But it sounds like we don't have any answers to the questions we have.
I know Becca sent an email to the applicant, and I'm not for sure if she received a response or did not receive a response.
What was this for? What month were they requesting for? Because Becca did not put that on there.
That's quite a bit.
So they are going to do some tobacco cessation, right? Tobacco prevention and cessation.
Mhm.
And they don't have a program now, but they have had one in the past, so they have experience with that
Okay.
and probably could get it up and running pretty quickly.
Mhm.
And that, that's one of our KPIs, of course. And
Yes.
currently, there's no tobacco cessation program in the entire county.
A lot of it was community health.
Okay, so part of the chronic disease prevention, I'm wondering if we're really gonna be able to meet that.
Well, they said they were going to look at cultural aspects and also going to be looking at chronic disease prevention and trauma prevention. So they're going to address those, I think, are quick. But it looks like a lot of it has to do with education. Yeah. And and they also talked about coordination of within the community. So those are all desirable things.
Can those be done by a health worker?
Looks like it.
By just health workers though, realistically?
And that's what it looks like. They're doing FTEs of 0.25 roughly. They have these employee benefits, community health workers. 2 of those. And then part of a director's position.
But is that
So
like
it looks like
just a
2
Toshiba
FTEs, I
position?
guess. Is
Where
that what
would
you
this
see,
be
Mark?
for?
2 FTEs, is that what you see?
Yeah, I guess I was asking, is that realistic to do all those things? And it
That's
may
fine.
very well be, absolutely.
I think it is for reading, I mean, it's just getting in the wheelhouse.
Yeah, I think the partnership would be tremendous. One thing I just don't support within it though is that pay for the director. So I think just 2 health workers
I was kind of going the
within
same way.
an organization, doesn't really matter, it could be Reed, it could be, you name it. 2 FTEs does not desire that much of a grant for money to go towards. So I think Dr. Detmer's right, this is in their wheelhouse, so I think they could do a lot of good.
So what are your thoughts on how we should proceed?
So are we just possibly discussing funding the community health workers and the supplies, equipment and supplies? Is that what we were considering?
I believe so, yeah. That was my recommendation at least.
Okay.
So 2 community health workers and supplies, or? Didn't they have 2 on the?
Well, yeah, that's what I'm trying to go back to the,
It's on page
because
4.
page 1 has 1 community health worker, 48, requested cost 72. Has that got all the fringes? Is that what that is?
Yeah, I think
Okay.
so. And then
But then the
another
other one is 60 total. So is it for a different time frame?
I think there's something about the community health worker 1 will be funded for 6 months. Well, that doesn't quite,
Would it be for the rest of this year?
On
probably.
page 4, they have 2.
Yeah, I got the 2, I just can't figure out the difference in the total salary amount. Maybe one's for 18 months and one's for a year or something? I don't know.
They've split it.
It says the first one will be hired in July of *24, and the additional will be hired in October of '24.
Okay.
Okay, that's it. Okay, that makes sense. Okay, all right.
And then I guess my question, would they proceed with the program if they don't get full funding?
Well, I agree with Mark, because I had the same thought. I don't know that you need to fund a director's position to have 2 people that they can be absorbed somewhere else under the umbrella of operation, I would think, so.
And Reed is already paying that salary.
Right.
Yeah, this isn't new.
Yeah.
So your recommendation was to fund the 2 community health workers, right?
Yeah, and the
And
benefits.
supplies.
And benefits.
Benefits and
supplies.
supplies.
Okay. I will second that motion.
Any further comments? All in favor?
Aye.
Aye.
Opposed? that covers the grants. I think there were one, and I think we're having a regular board meeting still on the 28th. So, a motion to adjourn?
So moved. Huh?
Decide how much we're gonna give.
Yeah.
75 each.
We have to do that today. I don't
75
think,
cents.
we have to do that today.
We have to award or send out the contracts for
Yeah.
signature between the 24th, unless you wanna meet in the next 2 days again.
No, okay, so how, have you got a formula on how to divide it?
So we have $356,218 in contractual services for 2024. And then 2025 is essentially up in the air because we don't know how much we're gonna receive in 25. But the minimum at this point for professional contract services is $837,957.25. So essentially we have $1.2 million between 24 and 25.
And that doesn't count the other funds, right? The
That's
school.
correct, that's only Health First Indiana funding.
Okay, so we funded 2 of them.
Right.
So
So
we
we
So
have,
we should take those off, right?
Yes.
And then,
Bertha 5 will be funded through Safety Pin.
Okay.
Boys and Girls Club, co-ed, school liaison grant, I think they can do
so then
extensions
what's
and
the
right.
total out of
What's
it?
total left?
Left that we need to fund?
So
So rehealth,
neighborhood is
So we take
188,557.
minus the,
Yeah,
we have to do the minus on the read.
neighborhood as well.
yeah.
Neighborhood is 188,557. And for Reed, we're subtracting. Reed is just gonna be the 2 employees, fringe and supplies.
Part of the
Mhm.
fringe.
So
Whatever
we're
Just
just,
the supervisor was all that was subtracted.
Yeah.
so we're gonna have.
There's a fringe in there too, so.
Yeah.
Mhm.
So when the 12.5 for salary and then fringe, right?
The community health worker I have is 60,000 for Reed.
No, I was talking about taking out
Director.
the
The only one we
director.
take out is the supervisor and.
The supervisor and the fringe for
That's
the
the third
For
supervisor.
the supervisor.
That's the third one.
That would be subtracted from their total.
Should've wrote down what I was looking at.
Yeah, it's hard to extract these numbers from this.
Yeah, this one's.
On that table, it has, there's a
Right.
table with the salary and then a table with the fringes.
Correct.
I
Page
had it.
4 there?
So the first employee listed on this table is community health worker, 6 month, at a wage of 24,000, then looks like fringe of 5,616.
Here it is, 14.5 is the director. And of course, the total cost is 21,775, so that includes the fringe.
Yeah,
So that would take out, so we take 260 minus 21,775, or 260, whatever their
Mhm.
total. 260. What their
20,
total-
27. I'm not seeing the numbers you're referring to, Jeff.
It's on that first table.
Oh, page 2.
Yeah.
yes.
The
So
21.
that's what we're
The
taking out. that
21,775
County health director
minus,
total,
yeah,
we're taking that away from the total funding request.
yeah.
The
The
amount
two,
requested is 260.
239,
So
something
it
maybe.
would be taken from that.
Yeah,
So it's gonna be their total.
So, yeah, 263.89 minus 21,775.
yeah.
What was it, 269?
263.89 minus 21,775.
That's what I get, I'm checking on, it's up there.
238,
Get it right, you
514.
win the lottery.
238 what?
514.
Okay, that's about right.
So that was like
514.
Mhm.
Pardon me?
hang on.
I have to hustle back
It's
office
actually
for a
just
training.
recalculated, it would be 238,614.
That's what their request is.
No, their request
I have
is
Excel pulled up.
260,389.
So that's the amount we would award.
I made Dan double check.
The board approved that minus the 21,000, so it'd be the 260,389 minus the 21,775. So the total award should be $238,614.
You got that? $238,614 for Reed.
So the amount we have to award this year total is how much?
Yeah, it's 300 and,
$356,218.
366, 56?
356. 218. Yeah.
So what, so you take 238,614 from that, and then what do we have left?
now mind you, this,
Is there some other else on
they've
this?
submitted for the end of this year into next year.
Yeah.
So
Okay.
some of the funding from next year will be used to
Okay,
cover this total cost.
okay.
So,
So we don't need to do that total then, do we?
No.
That's what it's kinda hard to.
I
How do
think,
we break out the transition of these? You know, Paul,
No, I mean, it's,
can we put it all in one bucket?
so I
Do it
think
that
right
way?
now, the board has to approve how much we're willing to grant the awardee, and then once they start meeting their deliverables is when we start giving them
Okay,
money
so we
from
take the
these
total
funds.
amount that
Right.
roughly estimated the 800 plus.
Right, so what, for Rita's instance, we'll have, their total account will be $238,614.
Okay.
And then as they meet the deliverables and we hand them money, we will subtract from this total number for the next year and a half.
Okay, okay.
And the same way with all of them.
So we should be okay then.
All
I
right,
think
so-
that the total, yeah.
Bert to five, we're gonna give 100,000
So the
out of the safety pin.
Yeah,
Yeah.
anything that we're gonna do with safety pin or COAG, we could fund that 100%
Okay.
Okay.
right away.
Well, we should be okay then, funding everything
Oh,
we
yeah.
approved today then.
Yeah, but we need to come up with what we approved, I guess. Was there anything else where we held out a position, or did we give the full amount?
Just Bridges
Was it-
was the one,
Bridges.
remember the one coach?
that would be, there was, out there,
Okay,
whatever.
so
was for
whatever
one,
that coach was for
That's
Bridges.
Whatever that
One
one
we
would
funded
be.
everybody else's.
Yeah, you're
Yep.
right, Jeff. So we've got the numbers. You've got the numbers, right?
The best I can, Dave, the best I
We
can.
got enough there to cover
There's
your payment.
confidence in you.
Now, is there anything else? you need from us?
No, just to award the rest of the contracts that you approved as far as dollar amount. So, but we're gonna fund the rest of them besides Bridges. I'm
Right.
assuming you're gonna fund 100%.
Yep.
Yeah,
I think that's fine.
Just Bridges and Reed, that was on
Bridges and Reed are
Yep.
the only things. Other than that, it's fully funded or non-funded.
Yep.
All
Could be
right.
Bridges too, Reed, right?
Huh?
Smart out of it.
Don't confuse me.
So my question is, do you have what you need from us, or do we need to make further decisions?
I think you need to make a vote that you're gonna approve these contracts for this particular funding, and then at that point, I think we can conclude. That makes sense.
So we're approving the contracts that we approved?
So I think someone needs to make a motion to approve Reed Hospital for X amount of dollars, and then make a motion to fund Bridges for Life, for the one recovery coach, which would be $27,880. And then I think after that, you could probably make a motion to fund in full Boys and Girls Club, Birth to Five, Purdue Extension. Yeah, and then may specify which fund they're coming out of.
Okay, I'll
So,
move,
yeah.
we fund Reed Hospital at the requested amount minus the coordinator position, which brings their total to whatever that amount is my motion.
$238,614.
Yes, that's exactly what I said.
Is there a second?
Second.
Okay.
All in favor?
Aye.
Aye. Opposed? Okay.
So the next one would be Purdue Extension. The board approved the contract to be funded with the COAC grant.
We already did that.
Now you have to make a motion to fund it in full.
For
Okay.
$88,300.
Well, why don't, give us the ones that we funded in full, and we'll make it in one group of everybody we funded in full.
Yeah, so this would be, so the Boys and Girls Club, Purdue Extension, will both be funded, the board approved to fund them with the COAC money in full.
Is there a motion to do so?
So moved, so I want to spell.
Okay.
Second.
Second? All in favor?
Aye.
Then, Bertha 5, the board approved the contract to pay it in full with safety pin money.
So moved.
Second.
All in favor?
Aye.
Opposed?
Bridges for Life, the board approved to fund one recovery coach to be funded out of Health First Indiana funding at $27,880.
So moved.
I'll second.
All in favor?
Aye.
Opposed?
The last one, the board approved neighborhood health clinic contract to be paid fully with Health First Indiana funding.
And let the minutes show that Mark recused himself in this vote.
I better not be able to motion.
So moved.
Second, I'll second.
There you go.
Okay, all in favor?
Aye.
Aye.
And that is it.
Thank you.
Thank you, Dan.
Thanks, Dan.
Nice job.
We won't ask you to go through that again.
I hope not.
Okay, is there a motion to adjourn?
I'll make a motion.
Second? Okay, all in favor? All right, whoever wants to stay.